I've been in and out of hospital since I was about 9 years old, and I'm 16 now, so for me, having PSC is just a normal day-to-day thing that I have to live with.
I was 15 when I was diagnosed with PSC and had my liver transplant at the age of 31.
They did my ERCP, which is a scope to the mouth that goes all the way to the liver, and that's when I got my proper diagnosis of PSC.
PSC stands for Primary Sclerosing Cholangitis. I describe it as a rare liver disease that affects the bile ducts.
PSC is a progressive liver disease that threatens the lives of over 29,000 people in the U.S. alone. PSC is not caused by alcohol or drug use. In fact, there is no known cause.
The cause itself is not completely known, unfortunately, but we are learning more in the last few years and will continue to learn about some of the mechanisms that lead to it.
There is no cure so far.
We do not have a medication, a drug, or any type of therapy that has been shown to alter or improve the course of disease.
The only thing we can do is manage symptoms, which can be severe.
For me, it usually starts with itching, like an overall itching.
My hair was like hay because I couldn't digest my food properly. I wasn't getting proper nutrients.
The chronic fatigue and the anemia.
I was very, very yellow near the end.
My eyes get yellow.
And then I get this radiating pain in my back.
It feels like someone's sticking a knitting needle in my side.
She was really jaundiced, yellow, tired all the time.
The disease ate away at my muscles so bad.
His health declined over another 1.5 year period.
Right before my surgery, I could literally take my hand and put it around my bicep.
Some of the complications of PSC can include progression of scarring, and that can sometimes lead to cirrhosis and the need for liver transplant, and that can be a source of significant problems and death in some patients.
They told us afterwards if Allie hadn't have got the transplant, she probably would have only had 2 months left to live.
It's hard to watch. It's hard to watch somebody you love fade away.
It's an illness, again, that creates a lot of anxiety because of its the severe nature once it's diagnosed, the difficulty in screening for it.
It took 13 years to get diagnosed properly.
You don't really think it's as bad as it is until, I guess 17 years into it, when things started to get dire, was then when I was thinking, wow, I guess I do really need a liver.
The disease has such a wide spectrum, it's difficult to write the script for a patient when they're initially seen.
Surgeon walked in, he looked at me, he's like, look, you're almost an adult, I'm not gonna hold any punches, I'm gonna be very real with you. You only have 6 months.
Before transplant, I was very sick. I had to stop going to school. I had to stop dancing and singing lessons and all that kind of stuff that I was doing. Spent most of my time in hospital.
Currently, as I think everybody knows, we have an organ shortage, and patients are sicker now at the time of transplant than they were 10 years ago.
Sadly, transplantation is not a cure, and patients face an uncertain future even if they're fortunate enough to receive a transplant. Worse, PSC can reoccur in the new liver, plunging the patient back into a world of uncertainty and risk.
Having faced my mortality at a young age makes you grow up really fast, and it makes you realize life is so fragile. Nothing's guaranteed. There might not be a tomorrow.
The thing I think that's most amazing about PSC is of all the illnesses that we see, it's probably the best organized and has one of the best advocacy groups of any of the other illnesses.
PSC Partners Seeking a Cure is a mostly volunteer organization supporting patients, families, and caregivers.
Every week we'll receive phone calls from patients, usually patients who have just been diagnosed. It's actually usually the spouse or the mom or the dad. They are absolutely panic-stricken, and it is wonderful that they can speak to another patient who's been through it. We're trying to both educate them and support them. So we have our conference once a year, which is our really big push through the year. We have a lot of information on our website where you can see all the research that's going on internationally. We have a Facebook group where people get a lot of information out of there. They also get support there.
When you think you're having a bad day, you'll be able to fight through it, and that was kind of some of the support I had from previous people that had been through the transplant through this group.
Our role is unique because we do support the patients and the caregivers as well. That's not our only job, but that's a really critical job, and I think that that's what helps shape our community, because you do have a sense of urgency. And these people need a cure. They need to find treatments.
Through PSC Partners' growing patient registry, patients participate in research and clinical trials, speeding progress toward a world without PSC.
Having that amount of information is absolutely essential in order to really be able to answer some of the key questions that we need to address.
We currently rely mostly on donations from individuals.
We need to fund research so that we can make sure that the near future includes all the hope we can bring to these young people, so that some year we're going to have these doctors show up and say, guess what? We found something that's going to slow the disease down.
Well, we need the money so that we can get funds for research, so that we can find a cure, and also to keep the foundation going, because it's such a great family we've got here.
Please donate to PSC Partners Seeking a Cure to give hope for a full life to the many thousands of people suffering with PSC. Join us in the fight.